everyone, I'm at Orthopedic and Sports Medicine Specialist of Green Bay, and I'm talking with Dr. James Grace. We're getting ready for the Bellin run. Have you ever run the Bellin before?
I have. I've been up and down those roads many years, since from the time I was a teenager till just recently.
And we're going to talk about some injuries that runners suffer from. What are some things when people are first starting out to train for things like this, new time runners? What injuries should they be aware of?
They should train properly. That's the key thing. If you train properly, injuries can be at a minimum. Training errors are by far the most common reason people get hurt. Injuries are common in the foot, such as what we call plantar fasciitis, which is pain in the back of the heel. There's another injury called runner's knee, or pain in the front of the knee. That's usually inflammation around the kneecap. There's another thing called IT band syndrome, or iliotibial band syndrome. That's soreness on the side of the knee. All those type of injuries can be treated with modifying your activities, exercising, rest, ice, things like that.
And when runners first start out, they might feel everything kind of hurts. What should they look out for, though, to make sure that they're not getting these injuries?
Probably persistent pain. Everyone hurts when they're working out. That's normal. But pain that lasts more than 24 hours or an unusual sort of pain, it'd be a red flag.
And since you have run the Bellin before, what advice would you give to runners that may be running this for the first time?
Probably be realistic and be reasonable. Train properly, set your goals reasonably, and enjoy the experience.